So when you hear the word healthy, what's the first thing that pops into your head? For a lot of us, it's probably something pretty simple, like, not having a cold, or maybe choosing a salad for lunch. But what if I told you the real picture of health is, well, it's much bigger, more complex, and frankly, way more interesting than that?
So, let me just ask you, straight up, thinking about your life, right this second, would you say you're healthy? It feels like a simple yes or no question, doesn't it? But as we're about to find out, the answer is hardly ever that simple. Let's see if your perspective changes over the next few minutes.
For a long, long time, our idea of health was pretty black and white. If you weren't actively sick, you were healthy. Simple. But that view is seriously outdated. The World Health Organization completely flipped the script, redefining health not just as the absence of disease, but as a state of complete physical, mental, and social well-being. And that's the key. It's not just about what's wrong, but about the active presence of what's right in all parts of your life.
A great way to picture this is to think of a three-legged stool. The legs are your physical, your mental, and your social health. You could be in the best physical shape of your life, but if you're struggling mentally or you're feeling totally isolated, that stool is going to wobble, right? Real health is all about keeping those three legs strong and balanced.
Okay, so if our personal health is this whole complex three-part system, how in the world do we protect it? Not just for ourselves, but for everyone around us. Well, this is where we need to zoom out, way out from the individual to see these invisible systems working all around us. Think of it like a giant health shield for your whole community. And that shield actually has a name: public health. It's this huge field of science that isn't focused on treating one sick person at a time. Instead, its job is to protect and improve the health of entire communities. We're talking everything from your local neighborhood all the way up to the whole country. And here's what's so important to get about public health. It is all about being proactive. It really boils down to two main goals. First, stop disease before it ever even starts. And second, help everyone in the community live longer, healthier lives. It's all about getting ahead of the problem.
So, what does that actually look like in the real world? Well, think about massive vaccination programs, or those organized efforts to stop an outbreak in its tracks. It's about launching initiatives that actually reduce how often a disease shows up in the first place. And it covers both physical and mental health challenges for the whole community.
All right, so how does public health pull off these massive goals? It's definitely not by accident. There's a really carefully designed set of strategies, almost like a playbook for prevention. Let's take a peek inside. So inside this playbook, you've got two key moves: prevention and control. Now, they sound kind of similar, but they're totally different. Prevention is about building a defense before a health threat even shows up. Control, on the other hand, is what you do when the threat is already here. It's all about damage control, containing it, and stopping the spread.
Now, prevention itself gets broken down into three levels. The easiest way to think about it is like a leaky roof. Primary prevention is like maintaining your roof perfectly so it never leaks to begin with. Think health education. Secondary prevention is when you see that first little drop of water and you scramble to put a bucket under it, right? That's early detection, like screening tests to stop a problem from getting any worse. And finally, tertiary prevention. That's the big repair job after the storm, when you're managing the damage from a disease that's already taken hold.
And what's the ultimate goal of all this? Well, for some diseases, it comes in two super ambitious forms. Elimination is a huge win. That means getting rid of a disease in one specific region, like how some countries have eliminated polio. But eradication, that's the final boss. That means the disease is gone, forever, from every single person everywhere on Earth. Think smallpox.
But here's the thing. Health problems don't just pop up out of nowhere. They are deeply, deeply woven into the fabric of our society. So now, let's talk about the big social forces that actually shape our health, sometimes without us even realizing it.
And this goes right back to that social well-being leg of the stool we talked about. It turns out that things like poverty, not having a job, or a lack of education, these aren't just social issues. They are direct causes of disease. The very conditions we're born into, where we live and where we work, can have a much bigger impact on our health than we think.
So that's a really critical question, right? When all these societal pressures actually result in someone getting sick, the problem doesn't just stop there. What's the ripple effect on that person's life?
See, being sick creates this whole new cascade of social problems. A sick kid can't go to school, which hurts their education. An adult might lose their job. It can put a huge strain on relationships, lead to a loss of independence, and even make it hard to communicate. It just goes to show you why preventing illness isn't just a health goal, it's a social one too.
Okay, so we have this massive, complex system trying to protect our health, but with all the time, money, and effort that goes into it, how do we actually know if any of it is working? That brings us to our final and maybe most crucial step, checking the results.
The answer is one powerful word: evaluation. Public health can't just run on good intentions. It demands that we systematically check and measure to see if these programs are having the effect we want them to. It's how we make sure we're putting our resources into things that actually truly work.
And this whole process is super structured. First, even before a program starts, you have formative evaluation. That's to make sure the plan is solid from the get-go. Then, after it launches, you have impact evaluation. That checks for the immediate effects. Did people's awareness change? Did they learn something new? And finally, way down the road, you've got outcome evaluation. This looks at the big picture. Did we actually see long-term health improvements? Each step answers a totally different but totally vital question.
So, when you put it all together, you start to see that even though our health feels incredibly personal, it's not a journey we take alone. Not at all. It's fundamentally supported, protected, and shaped by a massive community effort.
And that really leaves us with one last thing to think about. After seeing all these layers, the prevention, the social causes, the evaluation, what's one piece of your community's health shield that was maybe invisible to you before, but that you can see a little more clearly now? Thanks for tuning in.